Thank you very much, Doc, for your time here on ENCA. I did read the book, and I think what my colleague Samantha DeSantos and I enjoyed the most was the fact that children are able to even color in some of the characters as it goes.
Yeah. Good morning to you and the viewers. I tell you, I also love the book, even though I wrote the book myself. And we really wanted the book to be child-friendly and, more importantly, for children to get engaged with the book, not just reading the story, but as they color in, they get to think, they get their creativity out there. So that really was the intention, to include that in the book.
But also what I saw was that, of course, the book is about teaching children about COVID-19. It's important that it's written in IsiZulu as well for those who need to also only read in their mother tongue. But also it's the activities that are also added in terms of, for instance, there's a page where a child is expected to circle some of the COVID-19 symptoms that ugogo displayed.
Yes, you know, when I thought about writing this book, it was last year towards end of the year, and in my head I only thought maybe let me create a book that is educational, that only talks about COVID, information around that, how to prevent COVID-19 and the symptoms and so on. But then when I was doing preliminary research with some of the NGOs that work in far north of KwaZulu-Natal in big rural areas, because mostly those are some of the NGOs that I partner with when I think of interventions. You know, I was thinking in my head of a child that is in far north, in rural areas. They may not have access to resources or services that sometimes are more available in a more urbanized environment. So I was advised about two important things. The first thing was that the book must have factual information, but more in depth in families. It must have a little bit of information that relates to a loss. But I was a bit concerned about how best to present that so that a child won't feel intimidated and won't feel too or traumatized by the book if there is a lot of information around death. But more importantly, it must be written in a language that any child can easily understand, especially in those areas where sometimes English is not well understood at such a young age. So writing the book in IsiZulu, especially for our first batch of books, was very much intentional because we knew in our head the type of a child that we were targeting. And also even in terms of the language, the choice of words, even the pictures that we've used, we were quite intentional also about that, because we wanted a book that that is relevant for a child's context, that a child can easily identify with, especially with pictures and also the storyline. And may I add also that in fact the book, I mean the story itself is, we based it on a real life case. Obviously, we made changes here and there, but the essence of the book, it's based on a real life story. And I was privileged to visit the family when we had completed the book.
And Doc, you know, I must say we were quite sad in the office to realize that ugogo passed away in the book, especially, you know, knowing the fact that the book starts off by saying that this is who my name is, I am this age, I'm in grade 3, and my parent right now is my grandmother because my parents actually passed away. And then to find the grandmother succumbing to COVID-19, I guess you just wanted children to know the realities of what happens when a person contracts the pandemic.
Yes. I mean, I think when even when we evaluated children's views about the book, they also said the same thing. They were quite sad that Granny passed away. But again, that's the intention, that we do pass away and there is loss. And some of the children will experience loss, and some of them have already experienced loss. I mean, in South Africa, we have more than 50,000 adults that have passed away. And those are parents to someone, or uncle or aunt. So children are exposed to loss. But I guess the issue is how best to present such sensitive information to a child in a child-friendly way, and also to begin to have a conversation with the child about loss. Because especially with COVID, I think it has presented us with a very different way of dealing with death, where the child only sees sometimes the parent or the grandmother leaving the home, being sick, and unfortunately they are not able to visit their loved one in hospital. And all they hear later on, maybe few or a week later, is that their loved one has passed away. And the only memory they have is when that particular person was well and just getting sick. And sometimes for children, they find it hard to understand and to deal with that, because the only picture they have is the person that was well or maybe a little bit sick when she left, but they didn't expect that the person, that would be the end of it. So also the funeral itself leaves a lot of question for children. There are so many restrictions, and sometimes even family members are unable to engage children into those conversations. So I thought maybe the book really will be a starting point where a child, after the child has read the book, maybe the child will reflect or ask questions or begin a conversation, and then family members may join in and also give their inputs. So it's not a conversation that necessarily requires a professional. Family members, a teacher, can give some bit of clarity so that at least a child can express his or her emotions, what she felt. And even a child that hasn't lost someone in particular, the child will have a bit of empathy for another child that has experienced the loss. Because now the child will understand how it feels like. Because in the book, Mthembu talks about how she feels after the loss of her grandmother.
Yes.
So we also want to have children that have that level of empathy.
All right. Thank you so much, Doc, for your time and for that book. Congratulations on that. That was Dr. Maud Mthembu, social worker and lecturer at the University of KwaZulu-Natal.